I enjoy getting after it in the gym. And like a lot of people, the bench press is part of my routine. And if you belong to my gym, good luck finding a bench that is available on any given Monday. What I want to talk about today are the reasons why bench pressing can become problematic for so many people and share with you the things that I did to be able to address some of the shoulder issues I was having when trying to bench press recently. So, when it comes to the bench press itself, what separates the bench from a push up, for instance, is that when we do a push up, our shoulder blades are free to move. When we do a bench press, our shoulder blades are more pinned back on the bench itself, which restricts some of the movement options that we have through the shoulder complex itself and can lead to increased stress on the anterior aspect of the shoulder joint, which is why a lot of people tend to have pain and problems in areas through the front, maybe even within the joint or on top, but generally they resonate towards the front of that joint. So the first thing I did was make a couple simple modifications to the bench press exercise itself. First thing is, I took my grip in a little bit, made it a little bit narrower because that removed some stress from the AC joint in my shoulder, which is one of the joints in the shoulder that gets put under a good amount of stress when maybe we push it a little too much while bench pressing with a barbell. The next thing I did is that I decreased the intensity of the exercise itself. So instead of this big sort of rapid movement where I sprung back off my chest and had this more rebound effect, I added a pause. So I paused it on my chest a little bit. That seemed to do the trick and take away the pain. For some people, they may have to even add a pad on the chest itself to limit the range of motion, limit how far down perhaps a person is going, which then also reduces some stress in the shoulder itself. Sometimes people will even do an exercise called a floor press, where literally they're lying on the ground, and when their arms hit the ground, that is when the motion stops, therefore limiting that range and reducing that stress on the shoulder, much like the pad on the chest does. So we can reduce how rapid the action is, reduce the range of motion, reduce the width of our hands. We can also change the implement. A barbell tends to put more stress on the anterior aspect of the shoulder than dumbbells do, so we can change dumbbells themselves. We can also pay attention to where is the angle of our arms. Are we bench pressing way out here? Or are we in more of this 45-degree angle position, which tends to be tolerated a little bit better? We can also change the angle of the bench itself. Rather than being flat, we can incline, decline to add some variety so we're not just stressing the shoulder the same way over and over and over again on a flat bench. So those are modifications we can make to the exercise itself. Now, of course, that may not do the trick completely, because if you have any restrictions in the range of motion at the shoulder that is limiting the amount of movement options you have that you need for the exercise itself, so now you have less of the things that are required to do a bench press effectively, that is going to be a factor. And also, if there are some strength deficits in certain areas that are essential for the bench press exercise itself, we need to address those. That is where people like myself and my team come in so that we can assess you and determine what those factors are. If you are somebody who enjoys getting after it in the gym with the bench or any other exercise, but you're still continuing to have issues and you're looking for ways to learn to modify a little bit more effectively, or perhaps those aren't working and you need to figure out what the deeper reason is why this is continuing to have issues for you, give us a call. We would love to be able to help you. We love those folks who love getting after it in the gym just like us.